Everyone, I'm Renee Linyard-Geary, Director of Access Health at Roper St. Francis. I had the pleasure this morning of introducing our first speaker from the state level. Anton, you spoke a little bit earlier about when you see things burst into your plan. Being the co-chair of the Access to Care Committee, working on the T-CHIP and some of our planning, one of our goals was to bring the state level efforts that we see and engaging and integrating into our system level services and bringing it to life. And this is part of our plan in bringing it to life. One of our goals was to, make sure that we're meeting the charge at the state level, also at the local level. So with further ado, I'd like to introduce to you Rozalynn Goodwin. Rozalynn is the Vice President of Engagement and a lobbyist for the South Carolina Hospital Association. I'm passionate about improving the well-being of populations through health and human services. Rozalynn serves as the primary link with many private and public sector stakeholders, and that goes with our insurers and employers and many of our community level efforts. Rozalynn is a native of Mount Carmel, South Carolina, and she holds a bachelor's degree in healthcare management from Lander University and a master's in health administration from the University of South Carolina. Rozalynn is a Liberty Fellow and a Fellow in the American College of Health Executives. She lives in Columbia with her husband and daughter and son, and I saw a little special blurb with the Gabby's Bows. So also very engaged with family and passionate about family, but not only that, very passionate about one of the areas near and dear to me is access to care, and some of that is through your health coverage, and open enrollment season is here. And so if you will come up and engage with us a little bit more, everybody please welcome Rozalynn Goodwin.
Good morning. Oh, that was so whack. Good morning. Yes, listen. Healthy Tri-County, you all should be on your feet. This is an amazing initiative. Let's just stand up, just stand up, just stand up. Give yourselves a round of applause, a standing ovation for the work that you all are doing. I don't think you appreciate what is going on here in this area. You all can be seated. Listen, I'm honored to be here and representing the South Carolina Hospital Association. Hey, Annika, I see my coworker. Okay. Honored to be representing the South Carolina Hospital Association, which represents the hospitals across the state of South Carolina, where we have a view of what's going on in the state. And Annika, you can vouch for me, this is not going on. I'm thinking of maybe one other example where this may be going on, but you all have it going on in Tri-County. Listen, this is amazing. We are very proud of the work that you all are doing collaboratively, and I'll be talking about partnership and lessons I've learned from the porch, and y'all are like, okay, what is she about to talk about? We're gonna have a good time. But if I was a part of Healthy Tri-County, I'd just be humming to myself, can't nobody tell us nothing. I'm serious, this is legit, this is great. You all are truly making an impact on people's lives. I see Shelly, hey Shelly, I see some, okay. All right, stop with shout outs. Listen, let's get grounded, because I know that a lot of you all were rushing and bushing to get here. Of course, I was as well. So just indulge me for a couple minutes. I want you to close your eyes. Just kind of get grounded, get settled here, because we got a lot of important work to do that's going to impact the very lives of the people in this Tri-County area. So if you can just take a deep breath in, let it out. Let go of the thoughts you may be having about your 7-year-old son whose pants are probably on backwards and the shoes are on the wrong feet. It's okay. You might have had to yell at your daughter this morning, but it's okay. She's okay. She's resilient. She's okay. She's having a good day at school. And I want you to focus, and I want you to take a couple minutes, and I want you to think about home. What is home for you? Images, sounds, What is home? What do you think about when I say the word home? Is there a screen door? Are there chickens? Is there a smell of bread baking? Maybe some fried chicken in this healthy Tri-County meeting, I'm sorry. Is there laughter? What is home? What is home? I'm going to home this morning. You can open your eyes. Oops. When I think of home, I think about this little girl right here. This is Rozalynn. About 1981, in front of our rose bush back in Mount Carmel. So Mount Carmel, anybody heard of Mount Carmel? All right, this is part of my destiny to put it on the map. Mount Carmel, 231 people, everybody can, hold that thought. In McCormick County, you've got some McCormick, all right, nobody else is from McCormick, okay, Quentin Tompkins from McCormick. But that's what I think about home. I think about a screen porch, or not a screen porch, a screen door. Let me take that back, screen door, because the screen had ripped off and the flies and everything could come in. I remember when we replaced our screen door with like a real door, a clear door, and my 6'4", 250-pound Uncle Willie, patriarch of our family, ran slap into the door. I will never forget that day. It was too clear. It was not what we were used to. We were used to screen doors. But I think about that. I think about also sitting on the porch with my great-grandmother. This is Martha Morris, an amazing woman, and I'll be sharing with you 3 lessons that I learned from her at about this age about partnership. Now, this is our porch, and I was just thinking, I said, well, you're being a little generous with the word porch, because your porch was really just was really just where you parked your cars, but you had some chairs out there too. But I think about South Carolina, and I think about our culture and what all happened on that porch. So we had so many conversations on that porch. We would do what we called counting cousins on the porch. Anybody counted cousins? I sit with my great-grandmother, and she would say, well, you know cousin so-and-so? It was always cousin so you put a handle on that name, and she would count. She said, well, you know, what cousin is that? And I said, well, I think she's maybe like my 4th cousin, but I could count my 8th or 9th cousin. Like, we spent that much time talking about family, talking about community, and she spent that much time making sure that I knew that we all were connected in our community. I'm going somewhere. My first lesson that I learned from my great-grandmother is that everybody can. I don't have everybody is can. She said everybody can, okay? So as we counted cousins and we knew how everybody was interrelated and connected, and I had at least 3 boyfriends I had to break up with because we were cousins. We're cousins. I'm sorry, we're 15 cousins. We can't date anymore. God, he is so cute, but man, you're my 19th cousin, so we can no longer see each other. Everybody was kin. So we knew then, and she taught us that everybody was connected in some type of way. So the point is how it relates to you in this partnership is that even though we may have different views, we may be coming from different sides, we may even be competitors, but there's some type of common goal that we can all focus on together. And I'm gonna go through an example of what we did on the state level that demonstrates that everybody can. So in this room, we've got competitors. You know, hospitals that compete with each other. We've got various organizations who may be having some of the same missions, doing some of the same things. But if you recognize that everybody can in a community and you focused on what we can focus on together as a common goal, so many wonderful things can happen. And I'm so excited to share this example because we've got some partners here in the room who made this happen. So I'm gonna focus on ACA open enrollment in my first example. So we're going into the second year of, I guess, some changes with the Affordable Care Act, in which we have less time to enroll people, because when we first started off, we had, a full 90 days to get people signed up for the Affordable Care Act. Now we have half of that much time to enroll. So we had a number of challenges before us related to getting people connected to coverage through the Affordable Care Act. Over half of South Carolina's uninsured population right now qualifies for some type of subsidized coverage, but they're not enrolled, they're not signed up, they don't know about it. There's a barrier. And when I say subsidized coverage, I'm talking about not only the Affordable Care Act, but Medicaid or Medicare. There's some type of service that is available to them, and they just don't know about it. So we have been actively working to try to connect our patients to coverage on a statewide level through the South Carolina Hospital Association and our partners. So less marketing. There was a time that we saw buses with wrappings, or we saw billboards, and we heard commercials, and there were TV commercials and radio ads about the Affordable Care Act. Marketing drastically reduced, and even assistance here in the state level, we used to get about $1 million to get people connected to coverage in their local communities through the Navigator Grant program. That was reduced significantly to about $300,000 from over $1 million. Advertising on the national level, $10 million to just $1 million. So there was a lot of different challenges to make sure that people knew that they were eligible for coverage under the Affordable Care Act. Then there was no penalty. And then there was a lot more confusion about short-term plans and so many other things that were going on. But we recognized that with the Affordable Care Act still being the law, we needed to be able to connect people to coverage. And quite honestly, the premiums or the premium assistance or tax credits or whatever you want to call them were even more generous than they had been in years past, so people could qualify for even more generous discounts on healthcare insurance. But our challenge was making sure that they were aware of it and not having the assistance on the federal or national level to get the word out. How do you meet that type of challenge? And we even had people who were eligible for 0 premium bronze plans, which are still eligible. They'll still be eligible for starting tomorrow. Open enrollment starts tomorrow, November 1st through December the 15th. So we had hundreds of thousands of people in South Carolina who could actually get health care insurance on a bronze level, mind you, but 0 premium health insurance across the state, but they did not know it. How could we meet this challenge? And we could meet it through partnership. So what we did is, wow, I really like that jacket. Have it on again today. Everybody can, okay? Hospitals, competitors coming together, a common goal. We may differ on a number of other things, but this common goal we're working on right now is half of the people in South Carolina half of the uninsured in South Carolina do not have coverage, but they are eligible for it right now. Let's rally together, put aside our differences, and get our patients connected to coverage. So competitors came together. Brokers, navigators, certified application counselors, various organizations pulled together, advocacy groups, nonprofits. We may differ on a lot of different things. We may differ on policies. We may differ on Medicaid expansion, but when we get in the room, we're putting all that to the side, because right now we have a limited window of time, November 1st through December 15th. We've got to get as many people in South Carolina covered as possible. Let's put all those other things aside. Let's focus on this one common goal. We all are kin, and we're going to partner for this and make it happen. Churches, lawmakers, media outlets, whether it's TV or radio. You're looking at a picture of a phone bank we did in Columbia. And seated at the table are various brokers and navigators who actually compete for business to get people signed up. But they came together. and we did this all across the state. They worked together to make sure that we got people connected to coverage. And what we were able to do was South Carolina bucked against the national trend. While enrollment went down 4% across the nation, South Carolina enrollment actually went up. Give yourselves a round of applause for that. It was the first time we were able to get over 200,000 people covered and their coverage effectuated in South Carolina. So that is the power of partnership, when we all recognize that we all can come together with some type of common goal, set aside our differences, and make sure that we make a serious impact for the people here in South Carolina. Just a side note, over 92% of the people that we got signed up last year received some type of tax credit, discount, or subsidy. We're expecting the same for this year, or even more. So we really do want to encourage you to assist us in these efforts. The kickoff, of course, tomorrow, November 1st through December 15th, and getting our this area connected to coverage. The second lesson was go see about them. So we would sit on the porch and we count cousins and we talk about folks, but it didn't stop there. We took action. We'd get in the car, and my mom and my parents knew that, you know, on Saturday was the day my granny wanted to go visit people. She wanted to go see about them. She wanted to go check on them. She wanted to see what was going on in their lives. She wanted to know what their needs or their desires were. She wanted to know how she could help them. She wanted to know how we could activate this type of partnership and relationship that we have. Yes, we're in relationship with each other, but what are we doing? And this is what makes me so excited about this. You're not just creating a coalition in name. You're not just creating a hashtag in name. You're not just, but there's action, there's an assessment, and you're moving and doing action and policy based on the assessment. That's what makes partnership work. You take action, you go see about them. So for us, sharing a different example of something that was birthed out of the South Carolina Hospital Association. Around, early 2000s, and it still is, a lot of national media coverage on medical errors, just horrible stories of people's losing their lives or losing their quality of life because of errors that were going on in hospitals. Of course, a lot of scrutiny, warranted scrutiny related to medical error. So we really were sitting down with our members to figure out, what can we do to help? So we're visiting our members, we're talking with our members, we're pulling our leaders in. What can we do as an association to make sure that we are providing the best quality care in the nation? We want to be able for people to say that, if something happens, I am safer. I am more safe if I am in South Carolina. We wanted to have the type of high reliability that you have when you get on an airplane, where you don't even think about, we never hear about, well, not never, but rarely hear about there being airplane crashes because they are so highly reliable. And we wanted to strive to be like that. We wanted people to think about South Carolina hospitals as being highly reliable places for quality health care and services. So we started this effort over almost a decade ago about doing no harm. We partnered with Atul Gawande, who's world-renowned for his work in this area and safety, and wanted to make sure that we were fully embracing all that we could do to improve quality care here in South Carolina. So we implemented those high reliability programs that I mentioned to you. They started off with a simple surgery checklist, safe surgery checklist, to make sure across the state that if you were having surgery in a South Carolina hospital, there was a uniform checklist that everyone, before you went into surgery, they were making sure that these different things were done to make sure that your procedure was safe. And in 2013, it evolved, beyond a safety checklist and our work with Atul Gawande, that we wanted to start recognizing, now listening to our partners, listening to our hospitals, all of this negative press was coming about medical error, but they needed to be celebrated. They needed to be recognized for the work that they were doing. So we wanted to incentivize them. We wanted to recognize them. So we came up with the Zero Harm Awards. Back in 2013, we had 29 awards, and we were excited about this. And, you may think that, that's not a whole lot, but that was a big deal back in 2013. We were following through the data. Periods of time, 12 to 18 months. 29 awards were given to 19 hospitals. Watch this video. So this is in 2016, a couple years later. The incentives are working, and our hospitals are actively engaging and making sure that they go long periods of time with zero harm to any patients, and you see the hospitals listed there. So shift now to 2018. Listen, look at these numbers, over 549 awards given. Yeah, thank you. And you can see over $8 million saved, $8 million saved in 2018. Now I want to show you this next video because I also want to make the point and leave with you is it's great to have data, but I want you to see the difference between our video in 2016 and our video in 2018.
It's the first principle of the Hippocratic Oath. Do no harm. It's more than just a commitment to our patients. It's a commitment to our fathers, our daughters, to our friends, and our neighbors. This commitment comes at a time when medical errors are the third leading cause of death in the United States, which is why South Carolina hospitals are focused like never before on being industry leaders and improving the quality of care. By fostering a culture of high reliability across our state's hospitals, we have zeroed in on major areas of harm and worked to see them erased so that patients can get safely back to their lives. Because quality of care isn't just about the time you're in the hospital. It's about all of the time ahead. After all, we care about your experience as a patient because we care about every experience to come. Zero is our commitment to you because everything we do revolves around you.
Now you see the number of hospitals represented in the awards, whatever at the end. We could talk about it a little later, but data is great. Condense the data, process the data, but don't just stop there. Make sure your data is telling a story. You all see the difference between that video in 2016 and the one in 2018. Which one is more impactful? The one in 2018, because it shared the story. It wasn't just stats. It talked about what's important to people, their lives, and the lives that they'll be able to leave and lead once they leave our hospitals whole. My third and last point is may the works I've done speak for me. My granny used to hum this song all the time. And there's a great lesson involved with that. And I think you all just watching on the outside the work that you're doing here, it doesn't matter who gets the credit for this work that is going on here. You know, my great-grandmother, probably outside of our community, people don't know who she was, okay? It's part of my job to communicate who she was. But when I think back on her life and the people she took in, I mean, she literally would take in people who had no place to go. My oldest sister is actually a distant cousin, probably about an 8th cousin, who was born into a really rough environment, did not and still doesn't know who her father was. Her mother had some addictions. So at 9 months old, she couldn't even lift her head. My great-grandmother was around her mother, my oldest sister's mother, and basically said, "Give me that baby." She handed her over. And what has taken place in her life and her children's lives afterwards is a total transformation. My oldest sister, is going to school. Her children have gone to college. One of her sons is an elementary school teacher right in this community at Goodwin Elementary. Her daughter is a newscaster in Augusta. But if you look at the siblings who my great-grandmother could not take with her, their lives are totally different. My great-grandmother never got an award for that. And she did that for so many different people. She would just see a need and just meet it. She didn't care about her name being in lights. She just wanted to make sure that her work at the end of it spoke for her. No awards, no recognition, nobody knows her name. But the work that she's done, the work that she even instilled in me, is impacting people even past her death. So I want you all to be focused not on who's getting the credit for this amazing work that's changing lives and saving lives here in the healthy Tri-County community. But the third lesson about partnership is that it's about the work. It's not about you, boo. It's about the work. And when I think about that lesson, I think about another example, our Birth Outcomes Initiative, another statewide initiative that I'm sharing as an example that has done amazing work since 2011. You know, our hospitals basically got together and said, we got to do something about, and there was some research about early elective deliveries, how much money it's costing the healthcare system, and how many lives are being ended prematurely for moms and babies because of this new fad of early elective deliveries. And some of it was even just out of convenience, you know, inductions of labor being scheduled and those type things, and with the harm that was being done to moms and babies. So in 2011, we decided to just really focus on that. But what has evolved since then is an entire initiative about birth outcomes and having healthier moms and babies. So now there's a vision team that meets monthly. There's 6 work groups, all 45 birthing hospitals, again, competitors working together with our payers, who we can sometimes be at odds with based on reimbursement, all coming together, nonprofits, physician groups, everybody's in the room. I'm going to quickly go through what was just an effort to reduce early elective deliveries has evolved into so much more because we're focused on the work, not who's getting the credit. So of course we have reduced early elective deliveries. We're working on screenings, baby-friendly hospital centering, pregnancy, an amazing program that's spreading statewide that started actually spreading across the country, that started in the upstate. Making sure we have our patients have access to long-acting reversible contraceptives, supporting vaginal birth, all these different initiatives, even a mother's milk bank. So let me show you what some of the results of the work have been. Too quick. We've significantly reduced early elective deliveries by 8% here in the state of South Carolina, because we're focused on the work. Infant mortality is down overall, and then for particular non-white population, it's down by 20% because of all of these people coming in the room, focusing on the work and not focusing on who gets the credit, and making sure that our vision was even beyond just early elective deliveries. Let's make sure that we're ensuring the health of moms and babies. So when I think back to my great-grandmother and the impact she made because of those 3 lessons, recognizing that everybody's can, making sure that we take action and go see about people, and then that you don't get stuck on who gets the credit. Her work, as I mentioned, has long proceeded beyond her life. This is a picture of me in my first healthcare experience with AHEC at our McCormick nursing home, McCormick County Nursing Home. Miss Linda is standing over me, and somebody gave me a white jacket. I don't know why, but could nobody tell me nothing? I thought I was a doctor that day. But that's the importance of partnership. You never know who exactly you're impacting. And I didn't know at that time that I would end up being in healthcare because of the lessons that I learned about partnership on the porch from my great-grandmother. So I hope there's something that I shared this morning that continues to motivate and encourage you in your work. That keeps you grounded into what's important, making sure that you continue to be focused on the work. I am extremely proud of the work that is going on here in the Tri-County area, and I'm happy to take any questions for a couple of minutes. Thank you.